You're listening to localwebradio.fm.
Welcome to the Healthy Smiles Oral Health Show with Dr. Norm Ickert, brought to you by Ickert Dental Implant Centre, where they are committed to providing you with the very best in modern and advanced dentistry. Now, here's your host.
Hello, this is Nick Jaworski, and I am your host today. And I am here with Dr. Norm Ickert, director of the Ickert Dental Implant Centre, and today we'll be talking about dental implants and patient care specifically. Dr. Ickert will discuss what dental implants are made of and answer common questions, including how to know if dental implants are right for you. Now, before Dr. Ickert joins us, just a reminder that if you have questions or require assistance, that you can call his office at 604-881-1381. That's 604-881-1381. Dr. Ickert, it is great, as always, to be talking with you.
Thank you, Nick. I enjoyed my time with you very much.
All right. Well, we've got a lot to cover today, so let's just get right into it. And I guess if we're going to have a series of talks about implants themselves, we should probably start at the beginning, which is my favorite place. What exactly is a dental implant? Just as a definition of it.
Well, simply said, Nick, a dental implant is a prosthetic replacement for a missing tooth. Natural teeth, as you know, consist of a crown portion and the root portion, much like an iceberg. The part of the tooth that's above the water is the crown. The part that's below the water is the root. Mm-hmm. So the crown is the visible section that is covered with the white enamel. Now, supporting this crown, of course, on a natural tooth is the root, which extends just all the way into the jawbone. Mm-hmm. And the root is the part of the tooth that is effectively replaced by the implant. So it's the part of the tooth below the water, so to speak, that is the actual dental implant.
That's interesting, because I guess in my brain I would have thought it was sort of the part above it. And now are there different parts to dental implants?
Yeah, exactly. The actual implant complex consists of three parts. It's the implant itself, which is the part in the jawbone, and that's directly screwed or inserted into the bone. And then there is the connection piece, which is called the abutment, or a type of post, which is actually screwed into the implant. The implant itself is actually hollow, and so you can screw these little connections into the implant, which now stick through the bone, through the gum tissue, into the oral cavity. And now you can put onto that connection piece or the abutment the overlying crown or the denture or whatever prosthetic device that you choose can now be connected to the implant via this so-called abutment.
That's again, I know I say this a lot, but I'm always impressed with just the level of precision that we're seeing within our mouths, that what dentists are able to do. I'm always blown away by it. And I guess, moving on, what are these implants made out of?
Well, traditionally, the implants are made predominantly out of commercially pure titanium. It's a metal which is biocompatible.
What is, I'm a layman, biocompatible means?
Biocompatible simply means that it's a material that the body readily accepts. So the foreign body response that the body has for anything that enters into it is such that it considers this titanium as almost a part of itself, so it doesn't react to it.
Okay.
So what really happens then is that when you insert this piece of titanium into the jawbone, the cells have to decide if they like this or not. And so in the case of titanium, in the majority of patients, the cells say, hey, I kind of like this material. And so the entire process of acceptance begins where the cells grow towards the actual titanium and then actually bond to it in a biochemical manner. So it isn't just a frictional force that keeps the implant in, but it's actually a biochemical bond. And this is what we call in our profession osseointegration. In other words, there is an actual bony integration with this piece of titanium.
Wow, that's incredible. Osseointegration. I'm going to try to say that correctly. And okay, so are there other materials used? Is there any reason to use other materials for a dental implant?
Well, Nick, there is an increasing push amongst a certain group of the population to not have any metal components in their mouth. So there is a bit of a push towards zirconia implants, which, by the way, is still really a metal, but it's white.
Yeah.
But it is not really at the stage yet where it's mainstream. So it does work. There are tests that have been done, and there are certain zirconia implants that work quite well for the most part. But at this point, I don't think that we can say that they are a really normal, everyday, long-term solution. They are commercially available, but it's still a very small percentage of the cases that get placed with zirconia because there are definite limitations to them.
Right. And so most implants are going to be made of titanium because they've been proven to work, and we know that osseointegration occurs fairly easily.
Absolutely.
Cool. Okay, well, we have to take a quick break, so don't go anywhere. We'll be right back with Dr. Norm Ickert from the Ickert Dental Implant Centre, and we'll be talking more about dental implants, understanding how they go in, and what happens next. So don't go anywhere. We will be right back.
More Healthy Smiles with Dr. Norm Ickert from Ickert Dental Implant Centre after this.
If you've been known to enjoy a nice glass of wine, be sure to tune in to From the Vine to the Wine with Matt Berzovich on the Lifestyle channel on localwebradio.fm. If soccer is a part of your life on the Semiahmoo Peninsula, be sure to tune in to This is Soccer with Chris Murphy, Executive Director for Coastal FC on the community channel on localwebradio.fm.
Would you like to get more from the devices you own? Not quite sure where to start? There is help. Catch Powering Up for Non-Techies with Justin Martell, Computer Department Manager at London Drugs, on the Specialty Channel on localwebradio.fm.
It's time now for more Healthy Smiles with Dr. Norm Ickert.
All right, we are back with Dr. Norm Ickert, and now I've got my new vocabulary word, osseointegration, and let's go ahead and can you define sort of what that means and explain that process a bit more? I think it's fascinating.
Well, it really is fascinating because, to be honest, to go back into history, in the 1960s, a Swedish researcher, Dr. Brannemark, was interested in learning more about bone regeneration, and he used a model of a group of researchers from Cambridge who placed a titanium tube into in the jawbone of I think it was a rabbit. And the point is that they were trying to measure blood flow. And so he was using this chamber model for his study on bone regeneration. And when it was time to remove the actual titanium chamber, he realized that he couldn't move it. It wouldn't come out. And so then, being the bright mind that he was, he recognized something was going on here that was pretty peculiar, and it was this amazing attachment of the bone cells to the actual titanium. This process of osseointegration was coined at that time because he realized that these bone cells actually attach to this titanium surface. And that really is a magical discovery that has changed the face of dentistry throughout the entire world.
Well, yeah, I mean, that has to be better than any other option that you could do in the chair, right?
Yeah, no question that there is nothing that comes close. I mean, we know that when we treat teeth with root canals and crowns and all these things that we think are so great, but ultimately they weaken the tooth and eventually things start to break under certain conditions, whereas with dental implants, that generally does not happen. The interesting thing about dental implants is that when Professor Brannemark discovered this, he was trying to figure out, how can I learn more? How can I study this more? And he was, of course, thinking more of doing it in other parts of the body. But he realized it was pretty tough to study these things in hips and knees and things like that. Yeah. And so he thought very brilliantly, where can I get the greatest bang for my buck and learn most about bone? He thought, well, what about the oral cavity? And that's how it actually totally began as an accident, that dental implants became part of dentistry. It wasn't even designed that way in the initial part. It was just part of a way of gathering more data, more information. And And so those first implants that were placed by Dr. Brandenmark as a test survived, I believe, for over 50 years.
Oh, wow.
And I think that patient may still be alive now, but it's been just an amazing success story.
Wow. Okay, well, so then what is an osseointegrated, if that's the term, dental implant? What is that? What does it look like? What are we looking for?
Well, very simply said, Nick, it's this piece of titanium, this so-called titanium root, which is embedded into the jawbone, and now it sits in the jawbone like an anchor, and it's completely integrated into the actual jaw, and this anchor now allows you to replace single missing teeth or even a full arch of teeth. If you have more anchors, you can actually replace an entire arch, and you don't need one implant/anchor for each tooth. You can easily replace an entire arch from anywhere, let's say from 4 to 6 implants are enough to replace an entire arch of teeth.
Wow.
And these teeth then, of course, these replacement teeth are made to look natural with the same color as the teeth. You can even add pink for compensating for any lost gum tissue. And the whole idea, of course, is that this restoration will then be stable, it won't move, it'll be functional, and it will be aesthetic. And ultimately, it changes people's lives because now they feel they can eat and chew and function with confidence.
Now, that's fantastic. And maybe because I just wasn't thinking about it, that, the osseointegrated element of it is one part of the larger restructuring process, correct? You've got to get it in there, let it do its thing, and then there's a more of an aesthetic, functional element that can be easily replaced as time needs.
Exactly. I mean, implant dentistry is basically divided into 2 components. One is the surgical component, where the implant is inserted into the jawbone, and now you have to wait a period of time for that healing process to take place. And then there is the prosthetic component, which then means actually replacing the missing teeth with whatever system or design is indicated in that situation. Because you see, people don't come to us for implants, they come to us for teeth.
Right.
And so ultimately, we got to keep our focus on why patients come to us, to give them the teeth. But before we can give them the teeth that function and look nice, we have to create the support system in the jawbone, which is the dental implant.
Okay, well, there's a lot to cover in this topic, and during the break we talked about we're going to split it up into 2 so that we can make sure we get the depth that we need to get a good understanding of this process. So are there any final thoughts for now you'd like to share before we go away?
Well, I think when I graduated from dental school in 1982, it was made very clear to us that we would never indicate to a patient that our restorations would last a lifetime. And that was something that we see in practice, that things break down. And the nice thing that we can say about dental implants is that it is possible in the right situations and the right patient and properly performed procedures that these restorations can actually last a lifetime, which is something that we've never been able to say before, which is very, very exciting.
That is exciting, for sure. Now, in our next podcast, we'll continue this conversation about osseointegrated dental implants, and I'm looking forward to that. And if you know someone who would benefit from what we have talked about here today, please go ahead and share this podcast with them. I'm sure that they'll thank you for it. You can always reach Dr. Ickert at www.ickertdentalimplants.com. That's ickertdentalimplants.com. And you can reach him by telephone at his office at 604-881-1381 or toll free at 1-866-931-1981. Dr. Ickert, thanks so much.
Thank you, Nick.
Thanks for listening. At Ickert Dental Implant Center, we are committed to providing you with the very best in modern and advanced dentistry. If you would like more information about dental implants and our extensive range of specialized dentistry services, please call us today at 866-981-1381. That's 866-981-1381. Or visit us on our website at www.ickertdentalimplants.com.
Local stories, local voices. We're localwebradio.fm.
This episode is a production of Jam Media. For information on hosting your own web radio show, visit jammedia.com. That's www.jambmedia.com.
The opinions expressed by our guest and host on localwebradio.fm do not necessarily reflect the views of Jam Media or its owners. No expressed or implied opinions of any product or service should be considered an endorsement or recommendation of any kind by Jam Media or its owners.